Hi, so my name is Manny. I am a hair transplant surgeon, and today we're going to be doing a reaction video to a gentleman describing how to prevent his hair loss. It's the first time I've seen this video, so I look forward to watching it and giving you my honest reaction.
Hey everyone, so the reason why I'm doing this video is because in 2019 I started losing my hair myself, and I have never ever felt so insecure about myself.
So it's really interesting that he talks about his description of hair loss from from a few years ago. Typically speaking, most patients will come in and it can be a hugely daunting process, especially when you don't feel like there's a lot to do. So let's listen to a little bit more of what he has to say.
To a point where I would talk to this girl and she would talk to me back, and the only thing that I could think about was, is she currently just looking at my hairline? Is she currently watching my scalp? And it made me feel like shit. And that's the reason why I'm doing this video today, because you can fix your hair.
Yeah, I completely agree with this. This is the same sentiment that a lot of patients have when they come in and see me. They often are concerned, more so than even women, about the pattern of hair loss. I mean, a typical example that I remember vividly is a patient was sat opposite me and he described being at a cafe, sat outside, and he caught a reflection of his hair in the window, not even a mirror, in the window, and described having to get up and leave because his confidence went to zero. So completely empathize with this patient.
Do not have to go bald. You do not have to ever face that feeling of insecurity that I felt myself. So first you need to understand why you are losing your hair. There could be many different reasons why you are losing your hair. First is because you're deficient in minerals and vitamins. And the minerals and vitamins that you can be deficient that makes a big difference is if you are deficient in zinc, vitamin D, vitamin C and biotin. Those are super important for hair growth and making sure that you're not thinning on top of your head. However, if you are like myself and you have done your blood work and you know for a fact that you're not deficient in anything and you are hydrating, you're sleeping properly and not suffering from high levels of stress, then what you could be suffering from as well is male pattern baldness.
I mean, yeah, he's spot on. Those are exactly the essential minerals and vitamins, and I'm not sure if he's going to go on to it a little bit later on, but other things you could consider is iron deficiency is typically a common cause of hair loss, or anything that causes anemia. You also got B12 deficiency, so people who typically are more of a vegan-based diet, vegetarian-based diet, they're going to be more susceptible to being B12 deficient. But aside from that, he's hit the nail on the head. The other things, he's mentioning blood work, so it might be worth also thinking about his thyroid function, other autoimmune conditions, just making sure that you're in optimum condition. But aside from that, he's pretty spot on.
Suffered from male pattern baldness. Very easy to know if you're suffering from male pattern baldness, because the only thing that you do is that you have a look at your genes. You have a look at your dad, you also have a look at your grandfather on your mom's side, and then you will know what hairline you will receive.
Yeah, this is a very good indication. It's almost a roadmap as to where you could potentially end up. It's not definitive. Some people who have got a family history of significant hair loss end up with actually a relatively good head of hair. But the caveat, the old adage is, in essence, if your family members are bald, the likelihood of you losing hair and getting to that stage is going to be fairly high.
So male pattern baldness is because you are sensitive to a hormone called dihydrotestosterone, or DHT. Now there's many ways to block DHT, and in my personal experience you can block it in natural route, or you can block it the unnatural route. And blocking it the unnatural route will give you the most amount of hair back, or prevent hair loss the most. However, blocking it the natural route is going to give you the least amount of side effects. So there are side effects to any medication that you take. I have had side effects myself. What I found is that I tried the unnatural route, which I should not have done. So first, always try the natural route. There are 3 products that you can utilize. One of them are natural and seems to work really, really well, and that is saw palmetto. Now, saw palmetto, you take it at 320 milligrams, and the only thing that you need to know is blocks DHT. According to a lot of studies, according to myself as well, I got a lot of hair back on my head as soon as I started implementing saw palmetto. However, you need to take saw palmetto on a full stomach, because if you do not take it, you can get some nasty side effects when it comes to gut, and you can get a lot of pain for the stomach, which I experienced myself, having to sit on the toilet for freaking 4 hours. Number 2 is going to be utilizing finasteride. I have utilized finasteride myself, and I found that even though I didn't get any of the super nasty side effects like erectile dysfunction, I did get a decrease in mood and motivation. So
look, with the medication that you described, I agree. Saw palmetto works in a similar way to how finasteride works. So generally speaking, the profound side effects that he's referring to, low libido, your male appendage not working, it's interesting. What I find, typically speaking, is when men are losing hair, and he already described this at the very beginning, his confidence was in pieces. He didn't feel confident going and speaking to a girl. All he could think about was his hair. And unfortunately, when you feel self-conscious, when you have a lower self-esteem, a lower self-worth, your ability to want to have sex or want to engage in the process of intercourse is going to be relatively low, because you're hyperfixated on something else. And then when you add a medication to that entire process of what's going on, unfortunately, typically people will describe some form of psychosomatic issues when it comes to performing in the bedroom. So I think you have to take that with a pinch of salt. I've had over 2,000 patients actively take finasteride across the years, and a handful of patients have ever reported any kind of side effect specifically to their performance in the bedroom. There are things like if you are suffering from depression or low mood in general, it can perpetuate that, it can propagate that. If you're an older man, if you're over 55, for example, you know, you have to be cognizant of the fact that this medication, finasteride, is something we use to shrink the prostate. And if you're being actively invited for prostate screening, you should make sure that your treating team is aware of this, otherwise the markers might not be readily available. Finasteride is the gold standard, and I think you'd be doing yourself a disservice if you didn't at least try it, even if it was at very low doses. Let's carry on.
I do not like finasteride so much, however, I still take it. And what I do is I actually only take 0.25 milligrams utilizing a tablet cutter. And that is a great way for you to get finasteride, block DHT, but don't get the nasty side effects that you can get. I did try the finasteride as well in the freaking full dose, and I have never felt so bad. So I don't recommend anyone to ever take the finasteride. It's the strongest of them all, and I do not recommend it whatsoever.
Look, I think that there is a way to start medication, and he's done the right thing. He started off at 0.25 milligrams, and gradually you up titrate. The FDA approved dose is a milligram a day, okay? And most people in my clinic, they kind of find themselves between 0.7 and 0.9 milligrams. Again, this isn't catered medical advice to you. This is just a general consensus. So you up titrate till you hit that sort of dose and see where you fare. Sometimes you might need to increase the dose. Sometimes you might want to decrease the dose. So these are things that you can think about, and it's not just one size fits all. In terms of dutasteride, look, I've had patients who have taken this medication previously. Once you get to a level when you've been using finasteride where you're plateauing or the hair loss is starting to speed up, it is something worth considering. Maybe you can add it to your regime once a week, twice a week, something like that. But generally speaking, if you're going to experience side effects, they're going to be more profound with dutasteride. So it's not a case of not recommending it, it's a case of having certain things, an arsenal of weapons, which you can potentially tap into as the time is necessary for it.
However, what I personally do is I take saw palmetto every single day. Actually works as a testosterone booster as well, so that's pretty freaking amazing. Then I take 0.25 milligrams
So a little bit about the understanding. So you've got testosterone being converted into a byproduct called DHT, and in the middle of that pathway you have an enzyme called 5-alpha reductase. Now your body works on something called a negative feedback loop. So what does that mean? It means that when your DHT levels are dropping, it's going to push your body to produce more testosterone, to try and convert the testosterone to DHT. It's all based off of this negative feedback loop. So to say that saw palmetto is testosterone boosting would be a bit misleading. What's probably happening in the short term is because of the physiological changes to the amount of DHT, your body's recognizing this, and so you're getting a little bit of an uplift in terms of overall testosterone being produced.
Of finasteride 4 times a week, and that's for me seems to work the best without getting any side effects whatsoever. I know for a fact that I can take 0.5 milligrams of finasteride, but I don't see a big difference when it comes to how much hair I'm losing taking 0.25 or taking 0.5 milligrams of finasteride. So I always want to take the lowest dose possible because that's
I agree, and this is exactly my point. You should find a dose that you're comfortable with where your hair loss is stable, and you should consider experimenting with a slightly higher dose just so that you can measure and quantify how much hair is being lost. So he's not actually said what he's used to measure his overall hair loss picture with, whether that's a photo diary, whether that's someone actually using a camera on the hair so we can see the individual hair follicles. So it's a little bit misleading, and it kind of goes based off of a lay referral type system. So i.e. it's not medical backed, it's kind of, this is how I feel, this is more my opinion. It's not proper science.
That way I get less side effects, and I don't know what this is going to do to myself, let's say in like freaking 10 years or so. But if you actually want to regrow your hair.
So again, this is something that people need to understand. With finasteride, your DHT levels will be lower. As you get older, your testosterone levels are naturally going to decline. So when he talks about he doesn't know what might end up happening as he gets older, but I'll tell you now, your testosterone levels will decline, and so therefore your libido will also decline. You'll feel less hot-blooded, you will feel a little bit less energetic, which is why a lot of men after a certain age, they start on testosterone replacement therapy. It is what it is. This is just normal part of getting old.
What I found is that you can utilize minoxidil. Minoxidil is very common. I utilize it every single night. I spray, take a little bit of minoxidil, rub it into my hair in the areas where I'm currently losing. So currently, for me, it's my temples, as you can see right here. I then use this. It's a scalp massager. Okay, I rub it in and I massage my scalp for 10 minutes, and I do that every single night. One thing you can also utilize as well is microneedling. Okay,
Okay, before he talks about microneedling, minoxidil is a great treatment. It helps to dilate the blood vessels and therefore push the hair follicles into the anagen growth phase cycle. My preference is also topical, but I'm now transitioning into incorporating a bit of oral minoxidil. I'll save this for a later video as to why I'm a little bit on the fence about long-term use of oral minoxidil, but there is a significant reason for this. But yes, I would recommend using topical minoxidil in the first instance.
Needling, however, you do not want to get a roller that has 0.5 milligrams. It will have a very hard time penetrating your scalp. So what you need to do is that you need to get that's 1 millimeter, and then what you do, instead of rolling it through your head, what you actually do is that you point it in straight in. That way you will not damage your hair follicles. That's where you use minoxidil, you use microneedling, scalp massager, which I found is a spongy looking thing, and it really works very, very well. I use that, and I use it every single day. I do microneedling 2 times a week, and that seems to work the best for myself to regrow my hair.
I think it's a little bit overkill. So, you know, he's throwing saw palmetto at it, he's throwing finasteride at it, and he's throwing minoxidil at it. Microneedling, I'm not a big fan, just because when you're doing the process of needling on your scalp, you're penetrating the skin then has to heal with something, superficial scarring. It means that if you're going to have a hair transplant surgery, there is a possibility that the graft uptake will be slightly lower. A lot of people just don't really have an idea of what they're doing. They'll be frequently drawing blood. So my recommendation would be to stay away from microneedling, but everything else that you said has merit, and I agree.
One way to actually get thicker hair is to utilize something called gelatin. Okay, gelatin works very, very well. I actually combined it. I found this product back in the day that had both gelatin and saw palmetto. Gelatin will actually make your hair thicker, which is crazy, really, really good. But you need to also be aware of things that can make your hair worse.
I don't know much about the gelatin thing. I think that's more of a myth than science.
So number one is making sure that you're not smoking or drinking alcohol or consuming processed food, and also making sure that you are not showering your hair with water that has a lot of fluoride that really dries out your hair, damage.
Okay, so I agree with the concept of not smoking. Smoking is terrible in general. It's going to cause microvascular damage, which means that less blood supply is going to nourish those beautiful hair follicles of yours. Alcohol is neither here nor there, as long as you're not drinking to excess and causing massive issues with your overall homeostasis of your body. In terms of no processed foods, I think that's difficult in this day and age. I think most things are processed to a very, very high level. But yes, trying to mitigate this as much as possible is going to be great for you. And finally, the fluoride in the water. Now, in most water, especially tap water, you are going to find that they have got fluoride in it. So to avoid that is going to be very challenging. However, if you're in a hard water area, I would recommend using a water softener or some sort of filter in your shower head at the very least to try and help improve the quality of the hair that's landing on your scalp and your hair as a result.
Damage all of the natural oils that you have for your hair. Okay, if you do that, it's going to be very hard. It creates a very unhealthy environment. Your hair is going to be dry and you will not regrow your hair. So these are the things that I found that really works for myself.
And here's a quick sum up of this video. Thank you so much.
Okay, look, I think as a whole, I really like his kind of process. I really like his protocols. There are a few things that I disagree with, like the microneedling, for example. I'm a little bit on the fence about the gelatin supplementation. I think if you get your basics right and make sure you counsel your doctor about this specifically for your own personal needs. But yes, making sure that you've got a comprehensive set of bloods to make sure that there's no specific thing underlying, such as vitamin deficiency or mineral deficiency, making sure that your thyroid isn't underactive, making sure that you're not anemic in something. These are important things. Starting off with something like saw palmetto, if you're particularly concerned about the side effects of using a pharmaceutical medication like finasteride, it can be helpful. I think that the sweet spot for finasteride, whilst mitigating risk of side effects, is between 0.5 and 0.8 milligrams average daily dose. In terms of other things that he's reported, microneedling, stay away from. Dermapen, stay away from. You don't want to cause superficial scarring or increase the risk of potential infection post self-imposed procedures. And yeah, don't smoke. Live a healthy lifestyle. These are the basics. If you get those right, then you will put yourself in a better position for future hair growth and set yourself up correctly if and when the time is right for a hair transplant surgery. My name's been Dr. Manish Mittal. I am a hair transplant surgeon. Thank you very much for watching. Please like and subscribe. See you on the next one.